Thank you for coming out tonight. I think it's been quite a while since we did a community forum. There's been so much going on with Rome Health. I was actually out in the community a few weeks ago, and people were asking me all kinds of questions, particularly about the new master facility plan. A lot of the steel is going up. We just completed some projects and we're heading on to another. So it kind of started a conversation around how nice it would be to thank the community with a community forum. So we have some information to go over tonight, and certainly time for some questions, and hopefully I'll know all the answers to them, but if not, we'll work on them together. But to be able to talk about some of the exciting things that are going on with Rome Health. And I would say some of the information is not even everything, but through some of the conversation, I bet we'll get to a great deal of all the activities that are going on. Okay, great. So I usually kick off any types of discussions that I have with Rome Health related to our mission. Our mission at Rome is to provide quality health care with compassion, and we work hard every day to live out all that we do around our mission. As I talk to our team members and our workforce within Rome Health and even the community, we work hard to keep that important mission statement alive in all that we do. It's been our mission statement for many, many years, but how we live it out every day is keeping that current. Also, we talk a lot about transforming community-based healthcare. Rome Health is a community-based health network that's designed and been around for over 136 years. And what we work hard to do is make sure that all that we're offering becomes very current. And so these nice words of transformation and transforming really means as healthcare has changed over time, we want to make sure our network is changing to keep the delivery system in lockstep with how our community is growing, and it is. So we believe that great healthcare should be within reach of each and every member of our community. We believe strongly that's why we are focusing on providing convenient access to the best care out there here in state-of-the-art facilities. Many of us have experienced the great healthcare with Rome Health for many, many years, but we're really working hard to match our facilities and our planning for the future, our structures, to match our state-of-the-art team that we're providing care. I've shared this many times. When you're transforming healthcare, it's very important to map out what does quality and safety look like over time. So if you're seeing some of the slides kind of emulate some of what I call the trophies we've received in healthcare. And it's nice to be able to receive a trophy, right? Who doesn't want ribbons and to be the best? But what we mean by that is all the services that we provide, we will benchmark those services against some of the highest and best criteria in the land regarding healthcare. Healthcare is measured just like a lot of different industries, and we work hard to make sure that the greatest criteria that we can have to ensure quality and safety is being met. So when I see or you see some of those ribbons that describe some of Rome Health's services and service lines, that's really what we're referring to, is we benchmark all of our services against the strongest criteria we can have. So moving on to what we would think about making sure we can update our facilities to be state-of-the-art, just like our team and our team members providing the care. We've been on a fast track. I was just sharing with somebody that it's been a privilege to be able to have a very clear focus of what Rome Health is going to do into the future, and being able to have people investing in what's happening here so that our facilities can really match what it is that we're doing in providing that state-of-the-art care. So that fast track has been exciting. In 2022, the center that you're sitting in right now has been completed, and we launched that, and it's been very exciting. We've received a lot of very positive feedback about the medical center. Really what we were working hard to do was to try to provide an experience for the community and for patients that you could come to one place, or primarily one place, to receive a great deal of your care. And so it was important to make sure that we could bring a lot of the practices to one location. So this part of the campus is outlining that medical center so that we could bring primary care together with subspecialty services, together with state-of-the-art medical imaging and diagnostic care. And that has been very well received. People throughout the community have shared, boy, it's just amazing to go to our primary care appointment. And if we need some follow-up with a subspecialist, we might be able to interact with that individual. And or if we needed to have an imaging study, we know right where to go and we can move into that particular test pretty quickly. So very exciting. In 2022 and in 2023, we updated many of our inpatient beds. They had been dated like a lot of our facilities. And at the same time, we were investing in another service line, our bariatric service line, where we do medical and surgical bariatric care. We wanted to make sure our facilities were really updated with that level of service that we were providing. So it was exciting to be able to provide up-to-date, state-of-the-art inpatient rooms. It was incredible and heard great feedback. In those rooms, they're much easier to be able to take care of more acute needs for our patients, be able to move equipment in and out, and certainly aesthetically it feels really nice. The colors can really promote the healing process. In 2023, we were blessed to be able to have some ARPA funds from the county to be able to initiate a women's surgical suite. Historically, we had done our C-sections in the main operating room, which we'll talk a little bit more about. But with our growth of services and more patients coming to Rome Health, it was time to make sure that we could have a women's focused center where we could have certainly some C-sections that needed to be taken care of outside of that main OR and in a separate suite. It's absolutely beautiful. And our families have really appreciated because we've had such strength with family-centered women's care, particularly families giving birth. We have a high birth rate in our health system, which we're very excited about. So to be able to have moms and families not have to move to a whole other spot of the organization to be able to experience a C-section, but be able to stay right with their team in the maternity suite was just amazing. And again, hearing wonderful feedback with that. What you're seeing being constructed is the ICU and Kaplan Center for Surgical Services. As I shared a little bit, we've started to experience, particularly over the last 3.5 years, quite an increase in patient volumes, patients wanting to come to Rome Health to receive services. Some of that had to do with what we experienced during the COVID pandemic. There were lots of patients who couldn't maybe transfer to another place for care or really wanted to come to Rome Health at a different rate and pace. And so we were able to retain a lot more patients than we had been anticipating. And so we just had heard that the community really appreciated that. And we did see our facilities need some updating pretty dramatically in the surgical services space and ICU. So we were able to garner a great deal of funds. I think the state, the community, people within the community have been overwhelmingly philanthropic and gracious, and we've been able to start this particular part of our master facility planning very nicely. So you can see kind of the layout of what we'll experience. We did need to desperately modernize our operating rooms. Rome Health is licensed for 4 operating rooms. We'll almost double and a half the size of the main OR rooms, which is very exciting. What that enables us to do is take on some of the additional acute cases that we've been taking care of right now. We are limited with some of our infrastructure, like HVAC and some of our wiring, that it's difficult to do some of the highly technical cases all at the same time and keep all of our operating rooms running. So with this construction, we'll be able to do that. We'll also have 2 invasive rooms that are very large as well. So we'll be able to do more comprehensive services right in this part of the building and keep that consolidated. We've had a tagline that's guided a lot of what we've done internally: convenience without compromise. We really want to make sure that we're maintaining a strong patient-centered and family-centered feel, so people don't have to go even within the network in a lot of different places, but they can be right in one part of the wing. So very exciting to be able to say phase 1 of this particular part of our construction would be open really at the latest next summer. We're on time and we're on budget. And we were just talking a little bit how nice it is that the way we've partnered with our construction and our teams is that we're going to continue services while this construction is going on. So our Chief Operating Officer, Ryan Thompson, has worked with teams to make sure it's staged very well so we don't have to stop services while we would construct and update these parts of the facilities. So we do have a phased approach. We don't get everything all at once, but it'll be exciting to open this part of the wing next summer. And then our recovery room space will be worked on, and we'll open that up in a few months later, and then so on. And you can see some of the construction happening and impacting the main part of our hospital or our new lobby waiting room. So kind of in summary, with our master facility planning, what we're looking to do with that convenience and access for us, for all of you, it's all about access. How can we make sure these high quality services can be accessed by our patients very quickly and efficiently? I don't know anybody that wants to spend lots of time in the hospital. I do, but I get to serve all of you and serve the community. But as a patient, we want to make sure that people are taken care of safely and efficiently and get to move on to their lives and be healthier on the other side of experiencing Rome Health. So the main campus being able to have parking and access close to the medical center and our imaging suites, and then being able to have a section of the main campus that will be for surgical services and invasive services, and then of course the emergency department entrance. So the campus will be positioned, again, very conveniently as the vision, based on the type of services that you want to access. We don't want patients and families to have to go all through the hospital to try to find where they need to be, but it's that it's clearly available and easy and convenient. So with that, we'll talk a little bit about the ICU. We're very, very grateful for the City of Rome. Last summer, we received approval to be able to have support from Rome City's ARPA funds to be able to construct a new intensive care unit. Now, originally, this wasn't in the plan, but desperately needed. We've taken care of more and more high acute patients that need life-saving care. And that's been a privilege. But our ICU has been just as dated as our main operating rooms. So they've had some challenges. So to receive some of these funds and then be able to continue our capital campaign to be able to help supplement this particular part of the project is just incredibly exciting. So right on top of the operating rooms, we'll construct a new intensive care unit. And many people in the community have asked me, well, why didn't we renovate what we did have? Actually, when we started to price that out, it was going to be more costly to try to renovate such an old part of our wing than build new. So we had this kind of one-time chance. And again, so grateful for all the support because it ended up being a much lower cost to have it sized with this project. So being able to open that, we really do garner our sized rooms in the ICU will really be double. And there's a lot to say about that. We'll have a list of some things to expect, but we'll be able to provide private bathrooms. Today, we don't even have a bathroom that's even consistent with some ICUs that you can dispose of waste pretty efficiently. So very, very excited to be able to have private bathrooms. We'll be able to have a size in the room that we can have families. What I've come to know about the community of Rome, so supportive, so family-centered. People like to be with the care team, taking care of loved ones, particularly in a very acute state like needing an ICU. So we'll be able to have that. We'll have some advanced ventilation to make sure that the air quality within our intensive care unit is the highest standard that can be reached. Very helpful for continuing to have patients that have those severe needs and oxygenation. A lot of room for the medical equipment that might be needed to take care of the, again, sickest of the sick patients that may need it and access us. More natural daylight. This is really big for us. It's well documented that when patients, particularly those patients that are in a very acute and sickened state, that having natural light really does promote healing. And again, being able to have space for care providers to be able to stay right in the room. So making sure that we can have clinical documentation systems available, some up-to-date and very advanced equipment to be able to monitor patients that are so sick and so ill. We'll also be able to design the ICU where some of the practitioners and team members in the multidisciplinary team will be very close to the room. And you'll be able to see what's going on in the room in a way that's much more efficient and comprehensive than some of the older designs that we have in the ICU. So very, very excited about this project. It's been also pretty exciting. We've been able to advance some technology services. Many of you might have heard about some of the advancements in healthcare that's done on robotic. How many people have heard about robots and maybe, okay, great. Well, I'm very excited. It's been a little over a year since our Board of Trustees had expanded some of our vision around the master facility plan that we were just talking about to actually include being able to acquire a robot, which is very exciting for surgical services because robotics care has been somewhat of a standard that lots of very high quality surgeons have been trained on. And we have many, if all, of our surgeons in our Department of Surgery are very, very high quality. And some of ones that are fairly new were actually trained on the robot. So being able to have a robotic program here has been enabled us to recruit and retain high quality providers. But also there's a number of great outcomes that we can experience with robotic care. Really pleased that was approved by the Board of Trustees. Our foundation has offered and lended great support to be able to acquire the robot within a year. So pleased to be able to say that we have launched our robotics program. We've already taken care of patients on the robot, and a number of our surgeons are continuing to use that and expand the care that they provide to the community right here on the robot. So some of the outcomes with robotics care is people can expect to have some smaller incisions, some faster recovery time, maybe less time in the hospital post-procedure after having a case on the robot, less trauma to the body. Don't have to necessarily maneuver a body just as much because the robot provides such technical and point precision when you have a case on the robot. So some of our services that have already started to pursue robotics care is general surgery, bariatric surgery, gynecological surgery will be working with the robot next, and urology services. Another tremendous technology that we have worked on and has been started here at Rome is 7D surgical navigation. This is a particular technology that's used in spine care. And again, it really provides a guidance for the spine surgeon. Dr. Kenda is the surgeon that uses this particular technology, and they really have a point precision. So it can really isolate where it is the surgical case will be done in such a way that the surgeon can connect with that need very, very specifically and quickly. And again, just offers some outcomes that are much more expedited, some lower pain, being able to have smaller incisions, really, really wonderful and state-of-the-art for the procedures that we're providing right here at Rome. We're also very pleased to be able to announce, and right around the beginning of April, we announced our gastroenterology program. This was probably 3.5 years ago, one of 3 services that the community had shared with me they needed and wanted the most. Many patients were transferred out pretty quickly from Rome. There's been a backup with GI services across central New York. So to be able to launch this program, we're so excited about, and we've already been able to retain many, many patients right here in Rome that have desperately needed care. We've also been able to take care of patients outside of our area because the availability of GI is very, very low in central New York. So we have 3 providers. We have 2 physicians, Dr. Mirza and Dr. Wolf, and a nurse practitioner working with the service, Melissa. And we're pleased not only to be able to provide some of the general care for GI assessments and access, but also some very advanced procedures like EUS, endoscopic ultrasound, and ERCP, endoscopic retrograde cholangiography. I'll just summarize it that way, some long words there, but very excited to be able to launch these. And probably what's a differentiator for us is to be able to have scheduled care, invasive care on the weekends. Dr. Wolf being with us is able to work throughout the weekend several times a month, which we're extraordinarily excited about. That's a little bit different. Again, it's all about access for where patients are when they are in the community. So being able to expand regularly schedules hours into the weekend has been really important to us. So we're excited that this service has launched that for us. I have heard right from the beginning, so I've been with Rome Health for a little over 3.5 years, and in that time frame, we've had a strong focus on primary care. Primary care services, that's the big part of this center that we're sitting in, but that has been a need across, I would say, the nation, but certainly New York State, and more specifically upstate New York, is to be able to have primary care providers that are staying in the community and can have relationships with us for the long term and for the lifespan. So we've invested a lot in primary care. I have heard from the community that we're still having limited access and more patients want to come to us. So we've been able to kick off that we have 5 new providers that are starting with us throughout the next several months. And Dr. Parslow will be with us at the end of the summer. Brianna Tebow, a physician assistant, Chloe Bergman, a nurse practitioner, Laura Porter, a family nurse practitioner, and Marianne Turner, also a nurse practitioner. So you'll hear more about those particular providers being launched over the next few months, but excited that we'll be able to increase our capacity for primary care significantly with the onboarding of these providers. Also, again, with that expanded hours theme, we want to make sure really towards the end of the summer that we'll be opening up extended hours right here through the medical center. Again, the community has talked to me not just about our access, but access to low acute visits outside the emergency department across the community. There has been differing of access points with like the urgent cares, some other primary care offices, and then certainly the emergency departments at times can be really overrun. And so we want to make sure that we're doing our part in the medical center and expanding those hours. So we're very excited about that. We're working to strengthen our call center. Members of the community have shared with me that at times it's hard to get in to talk to somebody through the medical center. So we've been expanding some of the resources in the call center. We're really looking forward to supporting the community to use the patient portal. We're trying to make sure that it's a little bit easier to be able to do that, depending on some of us and how comfortable we are using a patient portal. We want to make sure that that's easier to use and more of us are accessing that, and that we can do more with the portal, like requests for prescriptions to be filled, hopefully in the near future have appointments that people can schedule online. Not all of us might do that. I'd love for all of us to be on the portal, but the way you access and use that information, that will help the call center be enhanced too for more critical calls if a lot of us are using the portal for some of those other needs that we might have. We have experienced, I was sharing this with a few people before we got started, we have experienced another significant growth in our emergency department. Our visit volume this year alone has gone up another 20%. Very proud of our emergency department. They're continuing to stay open. They have not gone on diversion, which people might hear a little bit about that. Lots of emergency departments across central New York do have to go on a state of diversion at times because their demand for services has increased their support. Our emergency department has not done that and continued to reset things, add some additional resources so we can make sure that we're taking care of the community through the emergency department. So we've also pleased to be able to achieve stroke designation, which I've heard quite a bit about that from the community. Why would we be stroke designated? That is a particular condition. Signs and symptoms of stroke, as well as cardiovascular needs, has grown in our region. That's certainly unfortunate, but here at Rome Health, we want to make sure we respond and teaching the community and making sure that we have a system that anybody who's experiencing stroke symptoms can be cared for very quickly in a way that is evidence-based, that we can have the best outcomes. Time for those urgent conditions means everything. So we did achieve stroke designation, which means that we've achieved a number of measures where our system surrounding a person that might struggle or might be having some of those symptoms is very well taken care of. And then if there's a higher level of need that might happen, an intervention that might need to take place, that we can transfer patients very, very quickly. So we do monitor patient flow through the emergency department every day. I would say probably every hour of every day, making sure that the emergency department is supported so that the community has that access. We are thinking about looking into the future that we may need to expand and take a look at our footprint on how to be able to continue that growth. part of one of the steps back to expanding those hours in the medical center is that's part of the way that we can hopefully take care of patients experiencing some more acute symptoms in our medical center a little bit later so that people can avoid the emergency department if they would like to and can do that safely. So that's hopefully a good pause point or stopping point to ask if there's any questions or feedback on some of the information that was presented. Yeah, sure. Mm-hmm. Right. Mm-hmm. Mm. Sure. Mm-hmm. Mm-hmm. Sure. Mm. Mm. Mm-hmm. 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 Right. 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 I think the question really lands very well with the vision of transforming community-based healthcare. So it's a very specific question around access, right? And how convenient, easy to access are our healthcare points in time or systems. So you just mapped out perfectly, and I'm so glad to hear because we talked about some of the formal structures we're putting into place at Rome Health, but part of the reason to bring caregivers together in the medical center is that we would work together as a team. I mean, maybe not exactly what was anticipated, but for me, what is expected is that we have such convenience and an open door here in the medical center that somebody who has a need that maybe can't get that filled. Sure. Yeah.
That's got a couple of children,
Yeah.
you got an earache or something. I mean,
Yeah.
they don't have, and it could be on a weekend,
Right.
so, and that plugs up the emergency room
Yeah.
for things that should not
Said. Well
be
said.
done in there. That's not an emergency. I
Right.
mean, it is to them,
Mhm.
and I wanted my issues squeezed out, but, bleeding, broken bones, are, that kind of stuff is you think more
Yeah.
for the emergency room.
The way I would answer access is largely around primary care. That's why we're investing so much in primary care and expanded hours. And to your point, more time for acute visits. Those visits that would maybe not in your regular annual appointment or your next scheduled appointment, but being able to have that visibility either through the portal or through communicating extended hours that people and patients can come into the medical center and be taken care of in a more of an urgent time frame. Thank you. Yeah, long time coming. So we're with you on that. Access is just key. Acute access that may or may not need an emergency department, which is really what you're describing. But something's going on with me right now, and I need to be seen. Thank you for that. Other questions or maybe comments? While you're thinking about that, I just want to thank the community again. It's been a lot of construction. And people have certainly shared with me how much construction that there is, but by and large, I've been so grateful how positive everybody's been. So it's a lot of workers coming in pretty early in the morning, right on the main campus outside your beautiful homes. So thank you for your patience with that. We've been able to stay on time and on budget, which for large projects can be a pretty big feat to accomplish, but it's really important to make sure that we can keep on time with opening up these services for everyone. So thank you for your patience with that. Mm-hmm. Yeah.
Using or expanding your telehealth work here?
Yeah, great question on telehealth. So we do have telehealth that's available that some of the providers use. There's been some shifts in terms of how reimbursement is going with telehealth. There was a wonderful push to be able to have lots of great support for that, and then it somewhat has backed off. So at this point, it is an offering, but we haven't had a lot of, I would say, interest in using that. Once we opened, people really wanted to come back to in-person visits. So that's why we've really added that resourcing for more providers that way. I would say also, we have our chief information officer calls it a information services desert, so to speak. We have a lot of investments that we need to make into the future, which is why it's so important to continue to stabilize our healthcare system, certainly from a services standpoint, but financially, so we can continue to make investments in our IT platform so that it's easier to access for patients. We want to get closer to people in their home, ultimately, right? So the telehealth pathway is a brilliant way to get close to people and make sure that we are addressing needs as proactively as possible. So I think there's going to be a lot more to come with that. Thanks for the question. Mm-hmm.
Hey, who pays for that?
Yeah.
How's that help?
Some insurance companies pay for that. Yep. A different type of rate. That was kind of what I was referring to, that there was, during the pandemic, there was quite a big push because we needed to have access. Right. Because there was limited in-person access. I think we'll continue to hear lots more. What we needed to really work on is, again, back to the access point, seeing patients consistently and wrapped in a services with a relationship with providers, because there was a lot of delays in care across the community. So that was certainly concerning for me as a healthcare administrator, that people had to wait on seeing clinicians, high quality clinicians, and there's been some impacts with that. So more to come. Yeah.
Just the doctors here in the primary care, would they be available on the weekend if somebody got sick?
When we're talking about the expanded coverage, there will be some providers that will be available over the weekends and into the evenings. We're still working through the scheduling and who that would be. To start, it will likely be one of our team of people that would be available. It might not be your individual provider, but there would be somebody that would be assigned for those extended hours and be available for the acute visit.
Not one of these primary ones, you would be able to come to a sick, if they're going to the emergency room, if the sick and need to have some professional to do advice, would you be able to come to them?
Yes. Mm-hmm. Right. So to start in the late summer, it will likely be the team that we have here that will be assigned and scheduled until later. So it will be the team that we're familiar with for those urgent visits within our medical center team versus somebody else right now. It's going to be our team of providers.
And every doctor here, can you come if you're...
I see what you're asking.
You can't go to urgent care because your insurance doesn't cover it, and your doctor's not available, or whatever.
Great question. Eventually, that's what we're going to get to. In terms of the timing of that, I don't quite have the exact date, but that's really what we're looking to do, because to your point, we want to be able to avoid the emergency department as much as we can and be, yes, exactly. So that's really what we're working towards. So we'll start with a panel of patients that are within our network with our team of providers, and then expand into being able to have even patients that are people that need to be seen that aren't within kind of our designated panel. In terms of the timing on that, more to come.
Question online here. It says, any thought or discussion about offering dialysis in-house? Patients get transferred to other facilities for dialysis, and it would be a great benefit to the patients to be able to stay in Rome.
Thank you for that question. We have thought about that. We have been tracking the amount of patients and discussions and what would be able to be available into the future. The way we base service line expansion or decisions off of is certainly the total amount of patients and how hard or how far it is to be able to access that care. And as we've worked through some of the information that we have on patients that need dialysis services, there are some access points that people have been able to be mapped to, but it's certainly on our list to continue to evaluate if we're able to take on that particular service. The best dialysis service lines are able to offer both acute and ambulatory or outpatient dialysis, and that's something that's a pretty big lift. So continued analysis to come. Thank you for the question. Good. Any other questions?
The affiliation with St. Joe's and how that, what that does for the community here.
Sure. The question was around affiliation with St. Joseph's Health. So probably around 2015 was a time frame where relationships were really starting to be built and I think analyzed in terms of how can we make sure that there are intelligence, that there's support throughout the changes of healthcare. So the Board of Trustees here in the organization entered into an affiliation agreement with St. Joseph's Health that really offers a level of intellectual support. Building relationships is very important in healthcare and quality relationships. So St. Joseph's Health has been instrumental in helping us be able to bolster some of the services that may have been really hard to acquire or be able to retain. For example, cardiovascular services. We have a cardiovascular clinic right here on site. And St. Joseph's has had a long-standing strength, particularly in the area of CV services. So being able to have them come on site with cardiologists was very supportive in enhancing some of that subspecialty need. We also work with them in terms of transfers, being able to have a center that we can transfer to a higher level of care. Not just St. Joseph's, we transfer to all centers when our patients need a higher level of care, but being able to work through some of those relationships to understand how we can make that as seamless as possible for patients. Rome Health stands today as an independent healthcare system. That is the expectation and the strategy from the board, but building relationships with other healthcare entities is always the right thing to do so that we can make sure that if a need arises, our patients within Rome and our community, we want to be able to serve you all the time in every relationship that we can. We don't provide all services, so when we need to be able to transfer patients out, we want to be able to welcome them right back into our system. So being able to have close relationships helps us be able to navigate our patients' needs beyond what we can provide. Did that answer the question? Yeah, thank you. Yeah, affiliation means a lot of different things sometimes. For us, it's we maintain our independence, and where is it that there can be value-added services to what we're providing? Great questions. Anybody else or anybody else on the live stream? Well, thank you again, everyone, for your time and coming out or listening in. Very much appreciate being able to talk about all the exciting things that are going on in Rome. We're, again, very privileged and thankful for all the support from the community. Many patients have given us great feedback, both what we're doing very, very well and both what we need to improve upon. So over 3 years ago, I had asked the community, as we start to grow and change, having that feedback so that we can shift and move in real time has been absolutely critical to continue to build and make sure we're shaping ourselves to meet all the community's needs. And we're constantly looking forward to exceeding everybody's expectations. So thank you again for coming out and listening in.